Well, and they've been doing a lot more, I think, over the last year or so about trying to almost mandate that, hey, we're going to deliver these drugs to you. So it's almost like the pandemic has like helped us fast forward what that looks like. What is the implications then in the hospital setting? Like, what is this going to do for hospitals if we're drawing patients from a physical hospital into the patient's home?
Exactly. So hospitals need to start to think about themselves as no longer constrained by the four walls.
Okay.
Right? The hospital now needs to completely go into the home. And so thinking about it without walls whatsoever. And so I'd love to see the hospitals partnering up with companies like Bioformis that provides that data platform to provide the hospitalizations at home. And that way it's not going to another company. They are still being hospitalized under that doctor, under that healthcare system, right? But you're just extending it into the home where they might be able to get actually significantly better care because of the ability to be able to sleep, right? Not be surrounded by infectious disease, and just be able to be in familiar surroundings. I mean, those three things alone are huge when you're a chronic disease or even end of life.
Yeah. No, and I think about some of the healthcare teams, right? So once you find that doctor that you connect with, that you've spent years, decades even, that get to know you, they know your family, they know your history, you don't have to repeat that. Like, I would hate to have to try to replicate that, but it sounds like even with the advancement in telehealth, in all of these remote monitoring devices, that we're still going to be able to have the access to our doctors. And yet we're still going to be able to have that in-home care in a space where we can truly heal.
Exactly. You've got it.
And this is so cool to think about. This is what the future is going to look like. And you didn't need Skynet to make that happen. It's happening now, which is amazing to think about. All right. So when we think about also too, respiratory disease and mental health, I know this is another big thing when we think about some of the epidemics that are also happening in today's society. The loneliness epidemic, self-harm and suicide rates continue to increase. And even with some of the Gen Zers, we know that those health markers or the mental health markers are happening earlier on in their teenage years. What are some of the things that are happening right now with AI or remote monitoring that are really going to help us be able to care for people from a mental health perspective?
Oh, so there's a whole new category called digital therapeutics. And the world of digital therapeutics is maybe 10 years old. Really, we kind of look at 2017 as having the first software apps that have cleared the FDA based on something called CBT, cognitive behavior therapy, which is a gold standard when you're talking about mental health. And so the digital therapeutics world is just starting up, but I think it's going to have a huge impact because instead of trying to have your mental health breakdown at 2 p.m. on Thursday, right, like which is what we end up having to do is, seeing a psychiatrist or a therapist, these digital therapeutics are companions by our side 24/7. And so they can work in conjunction with things like medication or therapy, but it gets to know you. Just like I was talking with the LEQ gets to know you over time.
Yes.
Companies like Twill Health. So Twill has a number of digital therapeutics already on the market, including one that's for medication adherence